Good afternoon, everyone, and thank you for joining us today. I'm really pleased to be welcoming you to this webinar around meaningful impact and supporting survivors and the lessons that we can learn from local practice in responding to domestic abuse. My name is Morgan Nasser-Finlayson. I'm a principal consultant with Mutual Ventures, and I'm joined by a really brilliant panel today who've got some really useful and really inspiring insights to share with all of you today. But before we dive into that, I am going to acknowledge the state of my voice. If you're struggling to understand me at all, please just shout in the Q&A. My colleague Luke is managing the Q&A function for today, so just drop him a message in there. You can also use it if you have questions for the panelists. Do submit these via the Q&A function, and Luke will keep an eye on that, and we'll answer questions when we get into the discussion properly. So, to kick us off, the issue that we are speaking about today, domestic abuse and also, to some degree, violence against women and girls, matters deeply, and it matters deeply across every part of our system. And I'd like to take a moment just before we speak to the panelists to talk about that up front. In a lot of our work with local authorities in children's services and also in our work with the Department for Education, it's fair to say that we have continued to encounter domestic abuse in these spaces. We've written about it quite a lot recently in a series of articles that you can find on our website, as unfortunately, violence against women and girls and domestic abuse is really high up the agenda in the UK. You will not be ignorant of the Office for National Statistics stat that around 4.8% of adults, which is about 2.3 million people, experienced domestic abuse in the year to March 2024. And when it comes to children, 18 months ago, it was estimated that over 800,000 children in England and Wales may have been living in households that were affected by domestic abuse in a single year. And domestic abuse is consistently a common reason for referrals to children's social care. While today's conversation focuses on addressing domestic abuse within the children's services landscape, it is really important to acknowledge the broader context and the overlap with violence against women and girls, particularly in light with the government's forthcoming 10-year violence against women and girls strategy. That commitment to halve violence against women and girls in a decade, accompanied by that strategy, is a really bold and really welcome goal, but it is also a really challenging one. Because let's be honest, this is really hard work and there are no quick fixes to this. Public services are hugely stretched, organisations that need to work together to operate under different mandates with different timescales, different accountability lines, different risk thresholds. There's data and measurement gaps, underreporting and hidden harm, where many survivors never either bring up the courage to or feel they can come forward to disclose or record abuse. When anticipating what the government's upcoming strategy might mean for local areas in practical terms, you absolutely wouldn't be blamed for feeling a lot of increased pressure and wanting to make a start on addressing what is already a beyond critical issue. There is a real need for clarity on how national and local partners will work together and align, particularly in sharing and scaling what works now. But if there is one thing that the recent NAO report highlighted, is that it's not well known in terms of evidence what does work well to tackle violence against women and girls and domestic abuse. So it can also feel incredibly difficult to know where to start. How do you develop local innovation that works for women and families and for survivors? What does a really strong enabling environment actually look like? And how do you scale and spread that innovation without losing any relevance to the local area? It's a lot of questions, but we'd like to try and answer some of those today, because everything has to start somewhere. So today we will hear about how Durham and Pause started that journey together, why it started, what they did, how they learned and adapted, and what that means for others who are trying to walk a very similar path. And to that end, I am really pleased to introduce our fantastic panelists for today. We are joined by Jack Tyler, who is the practice lead for safeguarding at Durham County Council. And we are joined by Paula James and Karen Bianchi, both from Pause, a national charity that works to improve the lives of women who have had or are at risk of having more than one child removed from their care. Welcome, all of you. Thank you for joining us today. I'll start at the beginning, a very good place to start. So, Jack and Paula, what have Durham County Council developed with PAWS and implemented to address domestic abuse and violence against women and girls? What did that journey look like, and what were the first steps that you took?
So I'll pick off Paula, just in terms of it. Just before we go on, Karen now works for Durham. She initially works for PAWS, but we've actually brought the PAWS service in-house. We've renamed that Future Hope, which was co-produced with our women. So now Karen's in Durham. I think you'd mentioned earlier, Morgan, in relation to our data showed us that domestic abuse was our highest referral into children's social care and our early help services, and has been consistently for a number of years, or at least the time that I've been in working for children's services. It's the highest reason for our children being subject to child protection plans, pre-proceedings and care proceedings. And I think as a service, we really wanted to understand what our practice was for families on the ground. Audit activity only took us so far, but we really wanted to know from a family perspective. So we started our journey initially working really closely with our public health colleagues who have the lead for commissioning our domestic abuse services. We are really fortunate that we've got a dedicated domestic abuse trainer who works across the partnership as well as children's services. And I think that's really beneficial in terms of having a consistent practice and approach to domestic abuse. There's lots of national material out there that describes domestic abuse from a victim's experiences, and as well as families' experiences of working alongside agencies, including children's social care. But we really wanted to understand what that meant for women and families within Durham. It was probably around this time that we were working with PAWS, who were supporting us, as I said earlier, bringing the PAWS service in-house, which we're now renamed Future Hope. And because we were working with PAWS, it brought the opportunity to deliver lasagna production with training our workforce. And I thought that was the real start in terms of embedding that culture change within Durham. Paula, do you want to just give a little bit in relation to the PAWS programme and your experiences of how we embedded that within Durham?
Yeah, I can do. Thanks, Jack. So I think it's really important, firstly, to say that women's involvement is a key element of the work of PAWS, and we have a strand of work called Getting Involved, and that really aims for women to be at the heart of decision making, so to work together to learn from them, develop the work, and for us to grow as an organisation with those right in the centre. And one element of that is working alongside women to co-create training and resources that can be used to upskill professionals, but also to be used for other women as well. But we really want to support professionals to think about how they work with women who've experienced the removal of their children in the future. What we also know is that around 90% of the women that we work with in PAWS have been subject to some form of domestic abuse. And that's an area that women talk to practitioners about really regularly, and they really want to understand the impact that that has had on them and on their children. So with that in mind, women and staff working with PAWS North East worked in partnership with a theatre company called Open Clasp and developed Lasagna, which is a 60-minute play, and it gives a real unique perspective and insight into women's lives. And it focuses around domestic abuse and the impact that that has pre and post child removal on the women. Women shared their experiences to shape the character of Sally and provided words and phrases they use with their children, and they are just beautifully written in and woven into the story. And one of the things that women told us, one of the most important things to them, is that professionals listen to them and think about the language that they use, and that everyone, no matter where they are in the system, will have an impact on birth mothers, even if they don't see that impact. And they wanted people to think about that the power they have to determine whether that impact is positive or negative, just in terms of the language they use. So Lasagna went on tour and screenings were held across the country. with discussion panels afterwards, and the event was really well attended in Durham. I think we had about 60 staff who attended, and there was some great feedback from attendees, and they gave really tangible examples of how they wanted to use that in their practice and how it would shape practice going forward. And that led us to have further conversations with the pause team in Durham about how we could use lasagna more locally as a training resource. And we've developed a 2 to 3 hour session. And then Durham have continued to use that as part of their practice and culture change.
Amazing. And it sounds as though the survivor voices were really critical to this. So when you were developing this local training offer, how did you really ensure that the survivor voices weren't just being heard within this, but were actively shaping that? Because it's different being able to translate down the play to the local context and make it even more local in a way.
Absolutely. I think the beauty of using Lasagna was that it was Northeast women's voices and their stories that had shaped it. But we did want to take that one step further and actually talk to Durham women and families on their experiences and give them an opportunity. So we're asking questions like, what do you wish, your practitioner had noticed? What would you like the professionals that were supporting you to have known? Reflecting back now, what were the things that helped you? What were the things you think could have maybe be done better? So initially, alongside the Lasagna film, we were also able to share some quotes from women, and then we developed this into voice notes and then some videos. And now, a few years down the line, we actually have women coming face to face to share their stories, their experiences, but also their reflections with practitioners. And this has been really impactful. I think it makes a big difference when it's a Durham woman and a Durham family story that practitioners are hearing. It's super relevant to their practice. And then off the back of that, as well as doing the Lasagna workshops, which we still run now, we've been able to develop other things that have been very impactful. And women have talked to us about the language that is used to describe them and their situations when it comes to court cases and also in reports they read about themselves. So we've developed language sessions where survivors are able to reflect on the things they saw written about them, things that were said about them, and then what was really going on for them behind the scenes. And that's been really impactful for the professionals that have come along. We've also been able to develop other workshops. We've done connecting families, so that's our new reunification team, and just creating a reflective space for them as they were newly formed to ask birth parents about their experiences, and where survivors were able to share their stories. Also, we've done workshops for early help managers, families first managers, training for foster carers, kinship carers, videos for prospective adopters that are used in the training sessions, and also had a young survivor going and speaking at corporate parenting panel. So across the whole breadth of children's services, we've been able to really embed the survivor voice there. And I think it's because with running what was Pause and is now Future Hope programme, we get to develop that long-term relationship with survivors. So we work intensively for 18 months, but even after that, we have a graduate support system where we meet up for coffee, and we're able to kind of be that safety net, but also that cheerleader, kind of still supporting them. So we have that trusting relationship. So we're able to really support them and offer that holistic support that's needed when you're making yourself vulnerable and sharing your story and your reflections in this way. So it's worked really well.
I think it's really important, Karen, as well, isn't it, to think about the support that we offer women when we're asking them to share their voices and when we're asking them to get involved. And I think that's a really important part of the work that both of our organisations do. We work with women to create resources for other women, like we have a Letters to a Woman from a Woman for our engagement phase, so that they can hear how women have received the service, and it really kind of makes a difference. But asking women to get involved in those sorts of pieces of work really requires some support for them to be able to process their own narrative. And I think both services, we work a lot with women, don't we, about processing what's happened to them, celebrating the things that they've achieved with them, and whether their stories are shared in a report or with a local board or with their families and friends. It's so important that that's meaningful to them, isn't it?
And it is also so important that, particularly for any local authority, I would assume, who is looking to survivor voices or to women and families to help them shape the services that they want to deliver to them, that like that does go two ways, that it's all well and good to invite people in to share their stories, but without that wraparound support, it really does leave the women and the families and the young people out on a limb without that follow-up aftercare to make sure that what they have done and what they have shared is processed in the right way. Can you share any examples of where, in sort of hearing that survivor voice, or as a direct result of that training, how that changed decisions either in casework, or in terms of the ways of working, or changed an outcome in some way?
Yeah, I think I can come in there. I think having the Women from Future Hope and co-facilitating some of the training's been extremely beneficial and impactful, not for practitioners across the board at all levels. I think hearing the women's direct experiences of their abuse and trauma, it's not only provided an opportunity for practitioners to have some insight in terms of what life was like for women on a daily basis, but I think it's also enabled practitioners to reflect on their own practice and how they're going to respond and be more empathetic in terms of their future practice. When I was prepping for this webinar, I was having a look at some of the practitioners' comments I provided in previous reports in relation to their views following on from the lasagna production. And I think that what we saw was exactly what we wanted to hear in terms of what they got out of it. Just a couple of the comments that I did pull out was one practitioner had said that they'd realised how much compassion was important in the work of a practitioner and how we can reduce the shame for women that's suffering domestic abuse. And another fed back to say that they needed to step back and think about the bigger picture in terms of the person behind the situation rather than just thinking about the domestic abuse. And I think that was really key in terms of this is what we want out of it and this is the impact. I was just thinking about one of the sessions that we did with the team managers. The absolute buzz in the room following the women talking about their experiences and just some of the reports that they'd wrote and that we hadn't been curious in relation to asking those different questions around what was happening and going on at that time. But the team managers, the absolute buzz, the enthusiasm, they were talking about the development sessions they were going to go back into, do with their practitioners and their teams, how they were going to reconsider children's plans, checking the language, etc., etc. It was so impactful just having that difference. I could never have articulated and done that on behalf of the women. So I think that was a big shift. I think another point is having the opportunities is extremely beneficial for the women themselves and enable them to have the opportunity to shape the practice because of their experiences and how we as in social care and across the partnership respond to domestic abuse. I think Karen touched on earlier of a young survivor who's been through Future Hope who came to corporate parenting. So I attend corporate parenting every year to present the annual report on Future Hope. I regularly talk about the women's journey. The feedback's always really positive, but I took Kay with us this time and I could never articulate her story in terms of how she did that within our own words. There wasn't a dry eye in the room from the corporate parents. She got a standing ovation. But the influence in terms of her being there within the key decision makers was absolutely immense. And I can't describe how proud of I was at that moment and continue to be. But Karen will tell you a little bit in relation to what that meant for her following on in terms of our own development and confidence, etc. So Karen, I don't know whether you want to jump on in terms of just giving some feedback in relation to Kay.
Absolutely. What a moment for her.
Yeah, it was incredible. And she often talks about how much she loves being able to give back to the service and that chance to have her story. She says it wasn't for now. She always says it wasn't for now. I've been through all this stuff and now I'm actually able to help other families and children and mothers. And I think the amount of pride she has in being able to do that and the confidence that she's developed. And And that kind of joint empathy between the practitioners when she's face to face and is able to share her story. And I think it's powerful for both sides. You often come away feeling extremely emotional and feeling like there's been some light bulb moments there. And I think about a session we did with the IRO team as well. And it was really lovely to see them look through a different lens, you know, because they're usually looking through the child protection lens, which obviously is really, really important, but to be able to look through the eyes of a victim survivor mother of what she went through in that whole process, and to hear them afterwards having discussions on, we need to look at how we do this, we need to look about how we communicate that to parents, we need to look at, and you know, actually thinking about tangible changes they're going to make that will make a big difference for families going forward. It was really lovely to see. Also with one of the early help sessions we did, Kay said, I just really want to help a younger version of myself. If I can help one person like me, I'll be happy. And at the end of the session, one of the team managers came forward and said, I want to say to you, you definitely have done that today. We have a young man, very similar situation to you. And as a result of what you've shared today, you know, myself and the team are going to go back and we're going to relook at things and relook at how we're working and the things that we're saying, the language we're using. And I just think that's so, so powerful for both the practitioner, the manager, but also for Kay herself as a survivor using her voice in such a significant way.
And I'd just like to add as well, Karen, thinking about that in terms of on a broader scale, the work that we've done recently, thinking we've had lots of conversations, haven't we, about languages. When we've met, we talk about language quite a lot. And we have, when women started their journey with pause, we would have an assessment of needs. And we've been thinking a lot lately about that word assessment when women have been through so many assessments already. And we've been working with women and practices across the country to develop that. And it's now called Understanding a Woman's Journey. And it is about understanding a woman's needs and how they intersect and how we can work with her to meet the needs that are important to her. And that starts now with a quote from a woman right at the beginning to explain to other women why we're asking the questions that we're asking and why we're thinking about the things that we're talking about with them. But again, just thinking about language and how listening to women and how they receive that has really helped to shape something that makes such a difference for women coming through the service in the future.
Yeah, absolutely. That language point is such a, it might feel simple, but it's actually such an impactful one. And an example that springs to mind is a colleague who attended a local family justice board conference, and it was attended by a member of the Family Justice Young People's Board, who really grounded everybody in that room by saying, I'm a real person. You know, I'm not a case. This is my life. Please don't talk about me in these terms. And the way that it pivoted everyone in the room that day, it was just one comment, but it really set the tone for how people would like to be spoken about and treated with respect through that process. And it's also so important towards an overall shift in practice, in culture within an organization. Language, it really underpins all of that. Were there any other key elements or key things that you think helped the practice and the culture in Durham to really shift so successfully towards that?
I think I could start by thinking about Pause and Durham as we started to work together, and it felt like we were both on a similar journey around domestic abuse. So we were developing our national domestic abuse training offer, and one of those strands was for all staff in the organisation, and that included Durham team, to attend domestic homicide timeline training. And then after that, we created some reflective spaces for practices to think about how that would influence our practice. And I'd worked alongside the Durham team to think that through and to embed that. But more broadly, we were thinking about how we could talk about risk where other professionals might not see the context of a woman's life. So we walk alongside women, so we see a lot more than other professionals, and they're a lot more open with us. So we might have a fuller understanding than other agencies about what's going on in a woman's life. And we know that domestic abuse is about a pattern of behaviour. So one of the things that we started thinking about was drawing out chronologies of domestic abuse so we could see the pattern really clearly, analyse escalation, manage risk. So at the same time as we were going through that journey, Durham were also doing the same sort of work, looking at a whole organisational approach, good quality training, really embedding and encouraging reflection, and embedding good practice and learning, and really centering women's voices as well within all of that. So I think that we were both on a similar journey that led us to kind of really thinking about culture shift and how we have common language and how we talk more broadly about the things that we're seeing. I don't know if you want to talk about Durham, Jack.
I'm having trouble with my mic on and off. Yeah, I absolutely agree with you, Paula, and I think that, as we've mentioned earlier, the influence of women co-facilitating training has been the biggest driver. Things gone off. It's been the biggest driver in terms of embedding change across the whole of the workforce, sorry, from the point of being our early help practitioners through to social workers, team managers, etc. I think when we've really expanded our domestic abuse offer, as Paula said, we've had homicide training, coercive control. We've really expanded that, but it wasn't really having the impact that we wanted it to have. So we really refocused that and said that we needed to start our training from the senior leadership team. So we did a session from the lasagna training, and we had that from our assistant director, the senior leaders, and then we moved that down to the wider management team before we extended it to the workforce, sorry. And I think that really ensured that we've got consistent messages and more curiosity and more challenge when we were talking about plans for children and circumstances for children and families in relation to domestic abuse. So I think that has been probably the biggest driver around that, the women participating in that, and obviously the senior leadership team, and then working down in terms of the workforce.
And just picking up very quickly on the point that you made, Paula, about other agencies and their sort of awareness of what's going on in a woman's life. It goes more into a kind of public health space, but obviously domestic abuse and addressing violence against women and girls is not just the responsibility of one place. It's not just in the local authorities. There are so many interactions with other professionals, and in some of the more tragic and sad cases where there's been multiple interactions with different agencies where women and families have fallen through the cracks. Do you have any reflections on what organisations, local authorities, any other professionals can consider in order to work better together across different organisational boundaries to try not to lose people and make sure that that full and rounded picture of the woman, of the family, is better known?
I think from our perspective, obviously it's us being involved in multi-agency meetings and us being able to talk to the woman and present her perspective. We often, as we run a DASH risk assessment with a woman, we'll ask a woman at the end what she wants to happen. So we can start to really think from a strengths-based perspective and think about the resilience she's bringing and kind of how each intervention might impact more broadly on her life and keeping her safe. So I think for us, really being involved in the multi-agency planning is really important. Jack, I don't know if you've got anything else to add.
Yeah, I was just reflecting on the what we've previously referred to as obviously the domestic homicide reviews and now DARDA. Sadly, there's been the introduction of now being able to consider the impact of women who's sadly took their own lives because of domestic abuse. I think we've seen a real shift in terms of working more closely with our partners and coming up with some key plans in relation to changes of how we work with victims of domestic abuse. We've had implemented in Durham, and we have done for a long time, a triage screening of all referrals that come into the police where children's involved with domestic abuse, and that is on a multi-agency lens. So that's with our police colleagues, our health colleagues, our Harbour, who's our commission services for domestic abuse, our health colleagues, and we really refer and consider what the need is for that family, and then signpost in relation to, and I think that's some of the impact that we've had around. But our key agencies, and I think I referred earlier to the fact that we've got Fran, who's our domestic abuse trainer in Durham, but she's multi-agency and she works across the whole partnership, which I think it's a great opportunity to bring practitioners together in terms of our learning together. So all of the training offer it's open to the whole of the partnership, and because we can able to communicate and talk about families on that level, I think it's been really impactful.
There's a follow-on question that's just popped up in the Q&A. Is there support and training available for educators in schools?
Absolutely. What I've just talked about in terms of the multi-agency training that we've got in terms of domestic abuse is open to the whole education, our voluntary sector, all of our partnerships. So yes, absolutely, it's open to education. And the vital,
Brilliant.
education's vital. And obviously because of the Operation Encompass, in terms of the fact that the referrals go over to the school, it's really important that education participate within our training.
Absolutely. It feels as though it's really important, not only that the reach of the training is quite broad and encompassing, but also that it's flexible enough to be delivered to lots of different partners and agencies and organizations, but also that it would need to be flexible and adaptive anyway because of the nature of domestic abuse and learning more and more about how it can manifest in such different ways. What would you say you do to make sure that you are staying flexible to continue to sort of stay relevant in the training that you provide to professionals and to educators and more broadly?
I'll start us off. I think that we are really focused in relation to continue to create opportunities to listen to children and families and professionals, and evolving needs in terms of domestic abuse. I remember when I became a qualified social worker many years ago, and how we worked with families with domestic abuse is far from our knowledge and experience of how we work with families now, and that's evolving constantly. And I was thinking about our journey when we started off with Pause and how much over the past few years how things have changed. So I think it's continued to evolve, and we need to have and understand their experiences and continued experiences of our families that we're working with. I think another element is responding directly to the needs of the workforce. So we're continuing to do needs analysis of the workforce with all of the practitioners, and that's not just practitioners, I said earlier, within social care, but it's across the whole of the partnership, our voluntary sector, our private sector. And where practitioners don't feel confident, we'll continue to adapt our training in terms of meeting need, and then we're starting off at a level, and then when practitioners or get that experience, we're providing more advanced training for some of the practitioners. We're keen on, we've got practitioners that are our experts within the field, where they've got champions in teams. So we've got, where social workers or practitioners on the workforce, on the ground force, can go and have those conversations around, so they're not having to, so there's somebody to reach out to. We're still on a journey in Durham. I think we're still learning. We've got a long way to go. I think when I think about where we started off and where we are now, we're in a completely different place. We're just at the point now where we're redeveloping our domestic abuse core training offer. This started very much in a way what we did with Lasagna, where we've done a survivor forum. We've done a training analysis in relation to the whole of the workforce. We've had some really good buy-in from the senior management team, and that's across the partnership and not just social care. Fran's worked really hard over domestic abuse training officer over the summer, and she's created a new training offer, and that's hopefully being signed off now. and we're just hoping to launch that in the autumn, by the end of the autumn. Yeah. Paul, I don't know whether you want to add anything to that.
Just that we've worked together for a number of years now, and I think that I've seen lots of curiosity from Durham and a real ability to kind of just take feedback from women's experiences and from the Future Hope team and change practice really, really quickly, or look at training gaps, etc. And I'm thinking about, for example, language, and thinking about, you know, when we talked about failure to protect or prioritizing the relationship over the children, and those phrases that we hear and that women that we've worked with have raised across the country, you know, in terms of the shame that they feel and the blame that they feel. And I really see Durham listening to that and changing practice very quickly, and starting to really embed those curious conversations across teams. It's right up senior leadership team, and change is happening. So I think that there is a real flexible approach in Durham, and I think that even as you say, the training offer, it really underpins and gives people a really solid foundation and a common approach across all services in Durham. Language feels like it's understood across services, and that's really important, isn't it, in any area, but particularly when we're talking about risk and domestic abuse.
Absolutely. And I know you've said that you are still on a journey, and I think it is a long one, because it's one that has to be continually adapted to. But what would you say has been the big change that you're really proud of to have witnessed since starting this journey? What feedback have you had since starting this?
Helen, do you want to jump in terms of some of the feedback from the women?
Yeah, absolutely. Women have really enjoyed being able to be involved in the sessions that we've done in the workshops. It's, as I said earlier, it's been a massive boost for their confidence. One of the women said that I'm absolutely loving doing all of this with you. I can't thank you enough. So they really appreciate that opportunity to share their stories. I think one of the things I've really enjoyed, because obviously I've been kind of co-facilitating sessions with survivors, with, you know, senior leaders and people from all different aspects of children's social care, and just how humble they are coming in, wanting to learn, and just, you know, admitting that no one's perfect, and knowing that we can all grow and we can all improve. And it's not a judgmental space, but it's been a real safe space for people to kind of reflect and process together. And I think the sense that the women's voices are really valued, as, you know, they're expert by experience, and that they're able to input into our practice going forward has been really amazing, and just seeing that increase as we go forward. So I know Jack was going to mention, after we did the session with the new reunification team, the feedback she had from the managers there. But likewise for me, the women that I took along were just buzzing afterwards, just really excited to think that sharing their story and their views was going to make a big, actual, tangible difference in Durham. It's really, really good.
Yeah, after the session, the strategic manager for the children and care team contacted us and said that the team after the session were absolutely on a high. They were so excited in terms of that session that happened, but and following on from that, some of the practitioners have said when they're looking at reunification plans and thinking about children return home, they think about Kay and the other women that went along, and the changes that they'd made. So I think it's that we're seeing that difference continuing, but no, that session just completely and utterly, the team were blown away, absolutely. Changed their focus completely.
Yeah, I can imagine that it's, I mean, even from my own very limited experience during a previous Trailblazers pilot of speaking to some of the pause graduates, and how that really shifted the dial for me on what their experiences were like for them, and what it meant in terms of the field of care proceedings, for example, and what their experiences were like compared to how the process should have gone. Hearing directly from them is very different from sort of looking at numbers in terms of cases, which often perhaps a busy social worker might look at a really long list of names, but those are all people, and they all have really rich and detailed stories behind them and really meaningful experiences that deserve to be listened to, because it does really fundamentally shift the way that you think about what you're doing. It really really fundamentally shifted how we were doing things, certainly. So I imagine for doing it on a day-to-day basis, that really has quite a strong impact on the workforce. So thinking then about anyone else's journey on this, you have obviously started from a really clear place. You've taken really definitive steps. You have consciously built in not just the survivor voice, but the voices of women from the Northeast and from Durham specifically. I think what if people were looking to do something for themselves in their own local authorities, what advice would you want to give yourself in a way for when you first started this journey? And what advice would you give to any other local authority that wants to start to take a journey in tackling domestic abuse and violence against women and girls on that whole system level, that whole organizational level?
I'll start off. I think it would be, Durham is unique in terms of it's a huge local authority, and our setup, it works really well for us, but it'd be really difficult to say that we can just uplift what we've done in terms of moving that to somewhere else. But there's definitely elements in terms of what we've done and implemented that could benefit from other people. I think we've been on our journey, we've done it slowly. We've reevaluated, we've made changes, we've looked at what training, we've commissioned different training in terms of that, as we said, the homicide timeline. We've had the coercive control, Dr. Emma Katz. We've had put on conference days with survivors, but loads of different types of training in terms of how that's impactful. I think we're really lucky in Durham that we've got a dedicated domestic abuse trainer that works, as I said, works across the partnership. And not many local authorities have the benefit of that. I think some of the things that I would say is that we haven't done this in isolation. We've worked really closely with our public health colleagues, and I actually meet with them and our Lead for Early Help domestic abuse lead on a monthly basis, and we move that to 2 weekly basis when we're trying to drive a change or something forward. And that's been really, really important, and it just keeps domestic abuse at the forefront of our daily agenda. I think, as I said earlier, the turning point for us in terms of seeing the biggest impact, other than the survivor voice, was starting off with the senior leadership team and then moving to the wider management team. And that's give us a really clear, consistent approach when we're overseeing and agreeing plans for domestic abuse, or any plans that we're working with. So anything that we now implement, we start off with a session with the leaders and then work our way down, rather than the fact of opening up training for practitioners and finding that managers are usually the last people that will enroll on the training. That's definitely something. And I think what we found is that when we've looked at the impact of some of our training and the changes that we have made, on a practical level, we're now seeing more recognition of coercive control and behaviour, which is evidence in our assessments and our care plan. We've seen a huge, I think, as Paula said earlier, improvement in some of the language and how we write. We're much kinder when we write about domestic abuse. There's more emphasis on a perpetrator rather than a victim. And we're seeing more mapping in terms of risk around domestic homicide timeline within our assessments and our evidence for court. And we're seeing that more within our DASH assessment as well. So I think that the key bits in terms of, for me, is working with your partners, working with your key agencies, and the voice of the women, of the survivors, and starting from the senior leadership team. Paula, I don't know whether you want to add anything, or Karen.
Yeah, I've written down just a few thoughts as well. So similarly to you, Jack, my first thing was create a space to reflect on and understand the areas where you want to see change and to really think about that. And listening to the people that you're working with. So do you already have those opportunities for people to give feedback? And how does that influence practice once that feedback is given? And is that feedback loop tied up so that people know that the result of giving their feedback? I think one of the other things was coming from a place of curiosity and not judgment when you're wanting people to really think and critique their practice and really look at what could be done differently. I've got a post-it note on my desk that reminds me, and it just says curiosity equals understanding and judgment equals defensiveness, to remind me that kind of a curious approach creates a space for learning and for change. Thinking about, is there an area, you know, where you could make a real impact and get people engaged? So we talked a lot about language. Women raise that a lot with us. And women have created a resource which is freely available on our website called More Than What's Written. And it is, again, a film created by women with a resource that offers different approaches to language and explains why that is really important to them. And then my reflection on the lasagna feedback, when I was looking at that over the time that I've been preparing for the webinar, is that it's really people just being reminded about the principles of trauma-informed approach. So what they're talking about is kind of thinking about families, thinking about mum's experiences, holding relationships in mind, you know, thinking about what happens to women afterwards. Thinking that's a good place to start. How do those values live in your organisation? How do they underpin your work? Can people give examples of how the trauma-informed approach lives in the work that they're doing? How do they create safety and trust, etc.? That, for me, really creates a human approach and a connection. And then from there, you can start to build and make a difference. So thinking about that, and also if you know other areas want to talk to us about lasagna training, then that is available from Pause too.
I've also just been thinking about how important it is to make sure survivors are well taken care of in this process, and that they have that wraparound support. I think for every 2-hour workshop I co-facilitate with a survivor, it's a lot of meetings beforehand, preparation, unpacking things, helping them decide how much they want to share, parts they might not want to share, and then also afterwards that containment and that debriefing and that emotional support. So just you know, we know it's not a ticky box exercise, but making sure that it really is something that's embedded through that that support and that trauma-informed practice all the way through, even when someone might have finished with your service and are coming back to give those reflections, to make sure that we continue to work in that way. I think it's really, really important.
Hugely. And my final question for you, Jack, and also for you, Karen, is you're on the journey. Hopefully this next sort of re-emphasis on your domestic abuse offer is going to go through. Where do you want to go next with this? What's in the far off ambition for Durham and for the Pause service within Durham?
My ambition is that we've got women who's co-facilitating all of our domestic abuse training in the future. I've been immensely impressed in terms of the courage of the women and who really want to tell their story. But I can put on all of the training in the world by, you know, some really influential people, but you have a session with a woman in terms of lived experience, and that will just blow you away in terms of moving forward. But yes, I think for me, we will get to a point where we really understand domestic abuse. We've got really clear safety plans for our families. We're supporting children remaining at home with brave plans and safety plans, but we're really learning from the experiences of our women. Don't know what you want to add anything, Paul. And I would really love to expand our service.
Yes, you don't ask Jack questions like that because she comes back with about 50 new things that she wants to implement in Durham. That is one of the things I love about working in Durham is just the innovation, and that we really are putting survivor voices in the heart of the decisions that we're making. One of the things we'd like to do going forward is to have a panel of graduates who are advising on a senior level with senior leadership, and that they're able to talk to and almost to cut me out of the process, so actually they can go and speak to people and openly and honestly about their experiences and the way things should go forward. So I think that's a dream for the future that I'd really like to see happening.
And I think just having people who really realise that what they have to say matters and makes a difference, because we often meet women who feel like their voice doesn't matter anymore. And I think being able to put processes in place where women value that and they feel valued, it just makes such a huge impact both on our practice and on their lives.
Do you think there's a possibility in the future for a new lasagna that has been brings into account everything that has been learned since it was originally produced?
I think it would be great. I think it would be great to produce as much theatre as we can around women's needs and women's experiences, because I rewatched Lasagna today before this because I wanted to kind of just remind myself, and it is so impactful. It really does make you think. It's so well done. And the voices of the women and the experiences of the women are so evident throughout that it is just brilliant.
Put something in my head now. In terms of, it doesn't take much of enthusiastic and getting our women involved in promoting change and change of culture. It's something I will be thinking of now. Watch this space.
51 things on the list now.
Most definitely.
Amazing. Well, we are coming towards the end of our time that we have with all of you. I would remind people who are still here to, if you do want to submit questions, please do submit them on the Q&A, and we will pick those up. But if you'd like to take a little bit of time just to reflect on what you've heard today, and follow up with myself or with the panelists, you are more than welcome to. This recording will be put on the website, so you'll have the opportunity to reach out to us through there, but we will include everyone's details as well. I've seen a question that's just popped up now. How big is your survivor network? How many people are represented or supported, or how diverse are the experiences within it? And also, can we watch Lasagna on YouTube?
Aaron, do you want to jump in terms of how many women we've had through the programme?
Yes, I think our number of graduates sits at about 62 currently. So everyone who graduates from the program has the opportunity to join the graduate support program, and then within that we share experience opportunities to be able to use your voice, and we're hoping to grow that as time goes on. I think I'm really mindful that it needs to be the right time for the woman to feel ready to share her experiences and to be in that place of reflection. And we do currently work with mothers, so obviously we don't have other voices currently there, but again, that's an area for development for us to be able to expand our services to include dads as well. And with Lasagna, you would need to either buy the license for streaming it, or like commission Pause or someone to be able to run that training opportunity for your team. It's not something that you just have, because it needs to be used as a training opportunity, not just as a movie, entertainment to watch. It's really important that it's in the right context. So, but that is freely available to be able to do that.
Yeah, and if people want to know more, if they want to contact me, Morgan, that's fine. Thank you.
Brilliant. I think people can find, I think there's a trailer that's available, which will give you a little bit of a flavour, but as Karen says, seeing the whole thing is very different, and also sitting within the context of the training and getting to reflect on it is a very different activity to go through. I don't think we've had any more questions pop through. So before I let everyone go for today, I just wanted to firstly thank all of you for coming along and talking about the journey that Durham and Paws have been on in the Northeast. I think, as I mentioned at the very start of this, because something like domestic abuse and violence against women and girls it's such a big topic, and it can feel really complex, and it can feel really difficult to know, particularly from a professional point of view, where do I start with this? Because there are so many avenues that I could go down. And in many ways, that there is not necessarily always a right place to start, but more the willingness to start by the sounds of the conversation, that it might be a really small first step that you take, but it leads to another one, and it leads to another one. Sometimes you might take a step backwards, sometimes it's 3 steps forward. But the really critical thing that I'm hearing from the conversation is that willingness to be able to say, we could do something, and then we could do something more, and continuing to build on it and continuing to change and adapt with it. And I think that flexibility and that adaptability to respond to it is also huge within this, sitting alongside all the really practical points of, being able to get that buy-in from your senior leadership team, and then being able to cascade that down through your workforce, not just for children's social care, but any parts of an organization that you find yourself in. So once again, I would like to just really thank you for your time and your insights, all 3 of you. And as mentioned at the top of this, when this recording is put on the website, people will be able to reach out to contact either myself or the panelists today. We hope that you have found this useful. We hope that you have found this insightful. But more than anything, I really hope that you would have found this inspirational for what you can do for yourself in your own area. We may be waiting for that new 10-year strategy to come out. It did say it was coming out in the autumn, so I assume that is now imminent. So while you're waiting for that to come out, I think the one final point that I would leave everyone with is we don't have to wait. There are things that we can do now, and there are things that can make a real impact that involve the survivor voice and bring their perspectives to the forefront of what we do. So let's not wait. Thank you all for joining today. Take care.
Thank you.
Thanks, Morgan.
Bye.